We're gonna to manage bullying. We're gonna learn to CBT, how to manage bullying and overcome anxiety, worry, panic, and intrusive those with cognitive behavior therapy. Okay, we're gonna learn the CBT, ACT, DBT. Okay. So, do you know the cognitive behavior therapy? Did you ever heard that? Have you been heard that? Within the field of psychology, cognitive behavior therapy is a very well-known treatment method. You can learn to use cognitive behavior therapy, helping to treat anxiety, especially depression and post-traumatic disorder, panic disorder, obsessive compulsive disorder, and more. CBT, cognitive behavior therapy, can help whether you've been diagnosed with a social anxiety disorder, major depression, post-traumatic stress disorder, or simply struggling without a diagnosis throughout your daily life. Why it is often better to go to a doctor and get a diagnosis of your illness at home with or without an official diagnosis. You can also use CBT resource separately. Okay, so you can learn to understand your mind better. Reserved, intrusive thoughts deal with day-to-day pressures and turn your negative thinking habits into something more positive. Cognitive behavior therapy is truly transformative, and you can change the whole of your life for the better with a little daily effort. So you this lecture will provide you with more comprehensive information about CBT. Okay. First, many people most people prefer to use interchangeably the expression worry and anxiety, which may make differencing between them in realistic terms of struggle. So we need to establish clear definition of these terms to discuss how to deal with worry, anxiety, and GAD means generalized anxiety disorders. So you can understand worry. Worry is cognitive process. It happens in the mind. Worry involves the mental anticipation and preparation of a potential future negative outcomes. We sometimes use awesome, awesome. You are taking your something. You, example, your car to shop for the tune up. For instance, you might think, what if? What if? What if there are major engine problem? It could be really costly, and maybe I can't afford it. I will potentially negotiate a payment schedule with the mechanic. But what if? What if he does not agree? I might say a long time with a car before I could pay for the maintenance, and without a car, it would be impossible for me to get to work on time. Therefore, worry can be described as a psychologically anticipating and preparing for the future and construct intricate scenarios in effort predict what might happen and how you might deal with different situations. What if something happened? But what if something happened? It might be then, but what if that happened? Then I could do this. Although people can worry about many different things, all worries tend to share some certain characteristics. Worries typically start as what if question. This makes sense knowing that you are trying to plan and prepare psychologically by worrying about the consequences in hypothetical future scenarios while you worry. If you have a planning, if you are planning a vacation, you might say, what if it's raining all the time? The question also raised concerns. What if it floods? I will not be able to do things I have scheduled, so I will have a miserable time. Perhaps I should talk about the rainy day things too. So, what if I have no fun idea to come up with a rainy day? Another thing is worries are thoughts about the future. Even if you are thinking about a past event, you are concerned about the future implications of the event when you're worried. If you worried, you could be thinking about altercation you had with a friend a week ago. What if our relationship can't be repaired? This worry focused on the possible future impact arising from the past event. Worries always negative. That worries are always negative. If you worried about potential future outcomes, you are not worried about positive things that might happen, right? As they don't require any mental problem solving. What triggers worries? What triggers worry? You might wonder what triggers worry in the first place, especially since there are many different types of things to worry about. So worry is an opportunity to learn about all these options and build a plan psychologically in advance. Okay? Unpredictable situation. Unpredictable situation. Preparing for written review. Preparing for a written review may be one example of an unpredictable circumstance because you don't know exactly what questions are going to be on the test. The condition is unpredictable. The condition is unpredictable. Will the question be hard? Will you want to feel nervous when you take the exam? Have you read the correct material to answer those questions? There is no way to say preciously wasn't going to happen at the test. A job interview is another example. Unpredictable situation, right? Exam or you don't know what your future boss will say during the interview, no matter how much you plan. They are more likely to think as a thought, what if she doesn't like me? She asked me a question, I'm not answering. Well, perhaps I won't get hired. Novel situation. Some scenario you've never been in before. It's novel scenario that can mean taking out a fitness class you never had before, starting new career, or going anywhere you've never been before. If you've never eaten sushi and friend invite you to sushi restaurant for dinner, the excitement situation can cause worry. What if I don't like sushi? I could end up paying for a meal I don't eat and then have to have a dinner somewhere else. Another things, ambiguous situation. We talked about worry, yeah? Ambiguous situations is one where it is unclear. There could be something positive, negative, or neutral. For example, if your manager asks you, he needs to see you. That's occurred circumstance because you don't know why he wanted to speak to you. It might be telling you then you've got a rise, positive outcome or neutral outcome in or negative outcome. You don't know. Since the situation is unclear and you don't know what to expect, you are more inclined to worry. What if he comes to see me because I have done something wrong? He might fire me. I could promise him I'm going to work better and not make a mistake anymore. But what if he disregards what I'm doing and fires me? When is worry a problem? When? When is worry about a problem? It's important to note that there are moments when someone is stressed, and that's perfectly natural. For example, at period of stress or big shift in life, we all seem to think more, right? You may find that you are more likely to stress when you have an elevated job obligations, when you have tasks, or someone in your family is sick, when there is a major occurrence in your life, whether moving a new home or getting married. Therefore, when dealing with unexpected, new, or unclear circumstance, most people still worry. The fact that you are worried isn't evidence that there is a problem. And when is it that or is it issue? Within the field of mental health, we find that anger is unhealthy when in the present most of it. It's disappointing, disproportionate for the situation. It's difficult to manage and interferes with everyday life of an individual or contributes to significant distress. Okay. We're going to talk about understanding anxiety. Whereas worry occurs in the mind, there is anxiety in the body. Anxiety is the common term for a number of physical feelings people get when they are in danger or they otherwise feel disturbed. The sensation of anxiety may include a racing heart, breathing changes, stomach problems. sweating, trembling, or shaking, hot flushes, or cold chills, general feelings of restlessness or jumping or dizziness or lightheadedness. So when we got anxiety, we think about fight or flight response. The problem with the anxiety, we're gonna know the problem with the anxiety. Since anxiety is a part of body's network of hazard identification, it's one of the most important survival strategies you have. The first problem with the fear is that it is caused if you believe you are in danger, even though you might not be in true danger. When there is no real danger, you can feel anxious. Anxious is your body's smoke detector. A good way of thinking about anxiety is a smoke detector for the body. Smoke alarms will warn you that fire is in your building so that you can get out as soon as possible. The same thing. Anxiety works the same way. When you are in danger, you may feel nervous, but when you know you are in danger, you might still feel worried. But obviously you aren't. Just tells you maybe you are in danger. The second anxiety problem is that it really only an ideal mechanism to cope with physical danger. If you are attacked and need to fight, run away, the response to the fight or flight does a great job of preparing your body to do so. However, modern day human beings, our daily threats are usually not physical. We are instead most concerned about the social threats and dangers we anticipate in our mind. For example, you might be worried about being late for work and potentially angry with your boss. Or you might be worried about what you will talking about when you meet new people at a party. Both of these situations can cause anxiety, but it is actually a physical threat. You're not worried that your boss will be so angry or so unfriendly to new people that they will harm you physically. And yet, but you are always nervous. This is because humans have only one system for the dictation of the truth in the body, and it does not distinguish between physical and social truth. While anxiety is anxiety is great for propelling you into action when there is a physical danger. It is less than ideal when the threat is social or caused by worries. Anxiety disorders, when anxiety become a problem, we're gonna talk to this. Anxiety is similar to worry, because being anxious simply doesn't mean you're having a problem. Anxiety's physical sensations are necessary to protect against hardship. It is also normal and unpredictable, novel or ambiguous situations to experience anxiety on person. Okay. There are a variety types of anxiety disorders, and there are many differentiated by what induces anxiety. If you jump leaves you severely anxious after touching a door knob or shaking somebody's hand, you may have obsessive compulsive disorder. If you get highly nervous, if you need an injection at the doctor's office, or maybe refuse all required injections, you might have a serious phobia, fear of needles or injection. In this case, in both cases, the anxiety experience is the same. No matter what the cause is, anxiety feel like anxiety. It is important to remember that the signs of a mental well-being aren't like a light switch, just being on or off. Such symptoms rarely occur completely. This is CBT most important concept. How we view a situation that leads to our feelings evolving is known as the cognitive model. This paradigm describes how we shape our opinions. We begin to change our views for the better by recognizing this pattern, so positively impacting our perception, feeling, and reactions. There are components: core belief, unstable assumptions, and negative automatic thought. From these three elements for cognitive, the model of core belief is what you begin with entitled to creation of unstable belief and negative automatic thought. I am worthless. That's core belief about yourself. The world is cruel about the world, the laws, and others. And no good will come. No good will come about the future, about yourself, about the world, about the future. That there are components. Our rigid and extreme convictions are called dysfunctional assumptions. Such conclusions don't really reflect reality. They're overgeneralized and unrealistic. The concern with this belief is that they often conflict with our ambitions and personal well-being rather than encouraging positive results. If I can do it well, then I might assign a weakness. If I can do it well, then I might just well not do it at all. If they hate me, then something must be wrong with me. To ask for support is a sign of a weakness. Negative unconscious feelings are the cognitive model's third and final step. In people with depression, anxiety, post-traumatic stress disorder, and obsessive compulsive disorder, these thoughts are involuntary and are most negative. The theological analysis of these three mechanisms is used with cognitive behavior therapy in order to understand the feelings behind a person's emotions. If you can charge the initial thoughts and replace them with something positive and true, you can change the feelings in time. For example, if a person feels overwhelmed, it could be because their core belief is, if I can do something perfectly, then I couldn't try in anything at all. And their negative automatic thinking could be, I made a big mistake that can't be fixed. Reading them to want to quit, the person can't cope with the real problem in order to address the feeling of being depressed. There are many ways to address the core belief, fault, expectations, and unconscious negative thinking. The purpose of this process is to help the patients learn how to identify and manage problems, enabling them to gain the skills to do this on their own so that the training wheels can come up, allowing the individual to excel independently. You will set goals for yourself to track improvement and help you know what might work or might not. This target should be specific, measurable, achievable, relevant, and timely in line with the SMART standard. SMART standard. The aim of cognitive behavior therapy is to improve how a person thinks, better known as their cognition, and how they behave, which is the behavior. CBT uses multiple methods to define a person's cognitive and behavior factors and guide change growth for this purpose. The exact techniques will vary from person to person and from case to case, but there are a lot of similarities in the techniques people use. These techniques are highly versatile and can be slightly altered for the individual. There are a couple of journaling types which are often used in CBT. While some people may maintain general journals to work through their feelings and situations, there are particular journals of thinking which is essential to the cycle of the concept. To restructure our cognition, we must be by unraveling its distortion first. To do this, we need to be more intimately conscious of ourselves, not hiding from who we are, but really allowing ourselves to see what distortion we are suffering. That's cognitive restructuring. This method can be used with some anxiety disorders, but for this technique, the most common and effective use is in the treatment of obsessive compulsive disorder or OCD, exposure and response prevention. The prevention is used as an effective technique to treat OCD with exposure and response to cognitive behavior therapy. The strategy will start small and slowly increase in intensity as the individual will be subjective to their compulsive behavior, but will try to avoid behavior. Play out the script. This approach is most widely used for people struggling with anxiety disorder, phobia, although it may be also help people with other forms of stress and anxiety. Example, if a person is concerned about late learning to meeting test scores or giving a speech, this strategy will help. Okay? Progress muscle result. Relaxation. If you are familiar with the practice of mindfulness, then you are personally already aware of gradual relaxing of the body. A person focuses on relaxing on set of their muscles at a time with this technique until all the muscles in their body and relax. You can do this either on your own or with audio support, that either sit up in a chain or lie down, and making it easy to practice wherever you need it. The technique is great to help smooth a hyperactive mind, relax emotions, making it perfect tool for treating anxiety disordered individual. Breathing exercise, very, very important. This will be familiar to people who practice mindfulness and meditation in conjunction with the previous technique. Breathing exercise is the perfect way to relax. The technique uses time and controlled breathing to powerfully relax body and mind. You can practice this method to work you through the process either on your own or with the audio. Whatever the diagnosis, this technique can be helpful. Whether you have depression, anxiety disorder, obsessive compulsive disorder, or simply day-to-day stress, doesn't matter. Active scheduling. A person has planned pleasurable activities to enjoy with activity schedules, which are to help the person treat depression and anxiety by systematically increasing the number of pleasurable experiences. It may take time for depressed person or re-enjoy their favorite activities, but the person will gradually improve by increasing their frequency. To do this, the individual should have a list of pleasurable activities, and then each week they should set aside time to at least one of those activities within their schedule. Larger activities like going to the movie can occur only once a week, while smaller activities such as enjoying a favorite snack should be enjoyed daily. Over time, this process will increase the number of pleasurable experiences, establish a daily routine, and enhance the problem-solving capacity of the individual. Behavior experiment. Behavior experiments often used with people struggling with anxiety disorders allow a person to overcome their catastrophic thinking and replace it with something far more realistic and balanced. If a person feels if they started to take part in a local support group, something terrible will happen, then the individual will put it to the test. To do this will write down what their fear is, test the hypothesis by completing the test, and then assess it to see if their fear was true or not. This means that the person may try to attend one of the local support group meeting, and then they will evaluate whether or not their fear of something terrible happened. a person may conquer his or her anxiety and depression with this technique. The cognitive behavior therapy include several strategies. Not all of these techniques are required for the same person to use, since the techniques will vary depending on individual contribution of the person. However, CBT has been proven time and time again to be effective, no matter which of the above techniques are required. Now, numerous studies and reviews have shown that this therapy method to be constructive in the treatment of mental health, such as depression or anxiety disorder. Nevertheless, multiple professional studies have shown that a person is much less likely to experience relapse in his or her depression over time if they use the CBT as a form of counseling. It doesn't have to be difficult to start with cognitive behavior therapy. You can easily learn how to adopt this amazing therapy for the better of both your present and future. Thank you. Next time, we're gonna learn the history of CBT and in-depth looking into what CBT can treat and why it works. Okay, see you next week. Bye-bye.